we took our end of year appeal from like 1.2 million to 3.2 million. And our appeal, I think, is about 450,000 for a doctor's day, which was a traditionally small scale appeal. And we just got people who are really resonating with the pieces and who were finding, their first donation was $500, that they were a grateful patient. We reached out to them. They had capacity and affinity that we could see. We could see their last visit date, and we were, several first time donations of $500 and above. And that's really noteworthy for us.
Welcome to the EverTrue Innovators podcast, where we meet the innovative voices behind the ideas moving fundraising forward.
Hello and welcome to the Innovators podcast. As always, I'm joined by my co-hosts Madeline Mad Dog Turner and Keith Vin Diesel is my hero, Maneri. How are you both?
I'm just over here enjoying living my life a quarter mile at a time.
And hopefully you'll enjoy answering this question. What changes when fundraising revenue grows by 169% in a year?
A lot of questions about how it happened.
Bingo. Using Donor Search AI acquisition modeling, this team significantly increased revenue, donor counts, and average gift size year over year.
Let's hear from Baptist Health Boca Raton Regional Hospital Foundation, winners of the Healthcare Fundraising Transformation Award.
Maya, congratulations again on being a 2026 Innovator. Would you mind telling us a little bit about yourself and the organization that you work for, Baptist Health's Boca Raton Regional Hospital Foundation?
Yeah, thank you. So I am the annual giving manager at the foundation, and I started about 2 years ago. And really, I'd come through a lot of nonprofit, through everything you can do in a nonprofit, from the bottom all the way to the top for the last 20 years. And when I came here to Boca Raton in South Florida, which is a very specific demographic, it is a community that is incredibly generous. Philanthropy is truly a part of the culture, and it is a predominantly high net worth area. So when I came here, I had never worked in a healthcare organization like this, in a demographic like this, with access to resources like this. And I thought, oh man, there's a ton of untapped potential here. And everything I had come to really geek out over the last 20 years, like I've studied the nonprofit sector. It's just what I do for fun and what I do for my profession, and I have degrees in it. And I was like, we can do a lot here. And not that they weren't already doing things that were, really noteworthy within the field and already noticed as a high performer in AHP, but just where we could really take our messages farther, reach more people, speak to them on a level that was really, I believed was really going to resonate with them. So really, as soon as I got here, I'm like, oh, I have big plans. I have big plans. So over the first year, it was really building the infrastructure to hold those plans. And now we're in our second year and we're really seeing it come to life and really it's fruitful in ways we didn't imagine it could be, and that is amazing. And now I'm like, okay, what's next? What do the next, 3 years look like? What's possible for this 5 year period that now we really prototyped in that first year, which I really wanted to do. And so it's been a cool and surprising ride so far.
So, correct me if I'm wrong, you've been working in nonprofits for 20 years?
Mm-hmm.
Oh,
Yeah.
wow. So obviously you just described a bit of what you saw that was different and hopefully exciting, I guess, in terms of assets and access, maybe at Boca as well. Thinking of like the specific annual giving program, I guess walk us through, what you saw when you sort of came into the program and then what ultimately you decided to do and to change.
Okay, yeah. So what was different here that I hadn't been used to working in was this was a very major donor focused foundation. And for good reason. It's a small foundation with a small team, and it is where the most return on investment was going to be for this hospital. And we are in a a part of South Florida that the population is growing faster than the hospital can hold. So we have this real big capital campaign that was happening for since like 2016. And so that was the major push, and major donors were the driving force behind that. Annual giving was, of course, a useful lifeline, but the lifeblood of it was our major donor program. When I came in and looked at our annual giving program, I had worked with Donor Search in the past and other organizations, and we didn't have anything like that. Were using a program that was doing wealth screening more one-to-one, so that the right people could be picked for the right portfolios. And we had a person doing that on a more one-to-one basis. And I wanted to see at scale our, thousands of donors, thousands upon thousands of donors, really what their giving behaviors were, what their capacity was, their affinity, where were they coming through, what services were they using here. And we didn't have a tool in place where I could see that. So I just had to keep sensing that there was something more we could be doing, but I didn't have the data or the insight to back up how we should be moving and in what directions. So it would have truly been a guessing game that I would have had to do a lot more trial and error if we didn't embed DSAI as early as I think as early as we could and as early as we did. And I'm glad, it's a big project within a hospital foundation because security is of the utmost importance to us, of course. And so we really wanted to go through all the right channels and work with all the right departments. So I think it took us about like 8 months to truly get running. And now what we can see uh, from a big picture perspective about our donor demographic, it's like having a deeper relationship with our people where we really knew our major donors, but we didn't really know our annual donor prospects and our annual donors who were giving. We just didn't have the internal resources to focus on those levels of giving. And now, because we can see potential and we can see the pipeline and we can see the movements easier, it's like, a game changer for us.
On that note, you had shared some of the the like ROI numbers or just success that you've seen from some campaigns and appeals. So correct me if I'm wrong on any of these. I'm just going to read off of my notes to make sure I get it right. But year-end appeal nearly tripled revenue.
Yeah.
There's a Doctor's Day appeal that went from $85,000 raised to $425,000 in the first month alone, which is, I'm bad at percentages, but a great increase.
The 407% increase from
Okay.
the full year before, and we're even higher now. So the full entire year, what we raised in the first month. And I do want to say it wasn't just DSAI.
Sure.
We worked with Beth Interactive on the communications pieces. So we
Sure.
built the strategy from the data we received from understanding our people
Yep.
through DSAI.
Yep.
And then we started designing messaging. What do they want to hear? Where are they coming through? What's their potential? What's their affinity? How many people are we talking about here? So we could really be choosy on budget of who's going to get a physical mailer, who's going to get a digital piece. And that strategy really took shape between the three entities. It was
Yeah.
really what built those numbers. And yeah, so we took our end of year appeal from like 1.2 million to 3.2 million. And our appeal, I think, is about 450,000 for a Doctor's Day, which was a traditionally small scale appeal. And we just got people who are really resonating with the pieces and who were finding, their first donation was $500, that they were a grateful patient. We reached out to them, they had capacity and affinity that we could see. We could see their last visit date, and we were, several first time donations of $500 and above. And that's really noteworthy for us, who we were based off of a very loyal, giving few. And now we're really starting to understand what it's going to take in our acquisition strategies, which was not a major focus from the past.
Yeah. What did that, I mean, I think it's a good picture to paint of like when everything comes together and you can really form a full strategy start to finish and like the success of that going forward with this coordinated effort. What did that, I guess, kind of like anecdotally more so, what did that feel like as you saw the success of these initiatives? What were kind of your thoughts as you saw these numbers rolling in?
I think it was really affirming of and sort of the power of when you mix intuition with data. So you're mixing the experience of what I feel like I've seen work over time, but no fundraiser feels like that comes with any certainty, right? So it's like this
Mhm.
feeling of like pretty sure it'll work. Like last, somewhere else I worked liked this, but every demographic is so different that when I had the numbers and the specifically visualizations, I'm a visual thinker, and I was the one, designing the strategy at that point, that when I had the visuals from DSAI, when I could really conceptualize the spread of who is where in what demographic, who's in our annual giving, who's in our potential for major donor pipeline, who do I really want to speak to in a major donor way. So we could design separate appeals for each that were going to land differently. That was a total guess for that end of year appeal, that we were going to really do maybe a more business-like informational appeal for those end of year givers who are giving and very tax savvy. And then those who wanted the storytelling pieces, and then really mixing those together was like, okay, we're going to roll the dice here. And watching the feedback loop of the data come in was like, oh man, okay, we've landed on something that
Yeah.
I think,
Mm.
who knows how long it will last. Is this a trend that we will uh, change over time? Maybe, but at least now we have the full scale data picture to more easily iterate and adapt quickly instead of guessing again. Like sometimes you feel overcommitted to an investment you made in the past in a strategy that you paid hundreds of thousands of dollars to design with a consultant. And now you're like, well, whether or not it's working, we've got to stick with it because we don't have anything else. Where this
Mhm.
is a little more like, what are the numbers telling us now? And the algorithm that continues to learn, and we continue to see new donors surface, and we can continue to see which donors really are probably not going to are on a portfolio and really don't need to be anymore, and can free up our major donor frontline crews time to work those relationships that are really noteworthy for them. And so all of this is like, it just has changed the way we can operationally prioritize. And for
Mm.
a small foundation in an area that's doing a lot of fundraising, I mean, last year we raised 72 million for a staff that was, I mean, we're at full capacity with about 20 people, but we were,
Oh my
at one
gosh.
time functioning with much less than that, and really pushing, like it felt like a lot of pushing and a lot of guessing at first. And now we're feeling like we can have a little bit more of a, I don't want to say automated, we're not that advanced yet, but it feels less like, okay, let's design this new appeal, see if this worked. Let's, oh, that kind of worked. These are like clear big wins. We can settle on that for a little while. And then while we clean up other areas of annual giving, doing the exact same thing. So I really wanted this to be a prototype sort of microcosm with our appeals. And then what else can we do now that we know more about this donor base that is truly feeding the pipeline for our major donors?
Yeah. It's a stronger way. You know where to place your bets a little bit more
Yeah.
than previously, which is always a good feeling.
Yeah.
It
Um,
is. Also, I think you very rarely hear in the world for major gift officers of someone leaving a portfolio, but maybe for the right reasons. Like, you know what, this person's still, they're still going to be engaged. We can kind of continue to steward them. We can continue to put them in
Yes.
the annual giving pipeline. But, this is their ultimately their time is really, really valuable. They're going to have to place it somewhere. So that's a great use. And I don't think I've heard that before.
And
Uh,
I think that's the challenging part, is when your loyalty and due diligence is to making best use of your donor dollars to really have life-saving, life-changing work in a hospital, you start to take every second you're spending on other things very seriously, right? Because it's a big deal. So if you have this portfolio of people who are used to being on a portfolio, but they could do with being on a more stewardship-oriented portfolio, well, you can design a strategy to catch that with the resources that match that are going to give you that sort of more appropriate ROI when if you can just keep the cultivation strategy going with the frontline people who really need to be doing cultivation, it's just to me the due diligence to your donors and to what they're trying to do is make sure that your hospital is always doing the best with its funding. And we as a foundation have to do the same there too, I think.
Yeah.
Absolutely. Um, Along the lines of figuring out, the how to communicate with people at the right time, or how to be able to best to understand more of this donor behavior. You mentioned that you discovered prospects who had a hospital or outpatient visit in the prior 60 days had significantly higher conversion rates than
Hmm.
a broader audience. So that's obviously something that's very, I think, also unique to the healthcare realm, to have that sort of moment, as something. So how did that insight kind of shape the way that you think about timings, story selection and everything like that in your appeals and messaging to that specific type of audience?
Yeah, I think like contrary to what I think the reputation of like fundraising is as like sales and just try to get any dollar you can and ask everybody. I think anybody in fundraising knows it's much more of an art and much more of a relational thing that we don't want to ask people who don't want to be asked. It's a waste of our time and resources, and it certainly doesn't feel like something we want to put on somebody who doesn't want to give, is not ready or capable of giving. We don't want to use our money to find those people. And so we're constantly trying to find the people who appear to be having, through the behaviors they're showing us in the hospital. Obviously, we can't see any uh, deep information. It's all HIPAA compliant, obviously. So we can see behaviors of the service lines or the institutes or their when they're going or how frequently. And so we kind of know they have a relationship with the hospital, and we just want to give them that container to give to if they so choose. If they're feeling moved by the care they got by their doctors or their nurses, if they want to make a gift in honor, if they're interested about how to give to cancer research, we just want to make sure that that message arrives to them in a timely way so that it's not a friction-filled process for them of like, how do I give? We get calls sometimes where people are like, I couldn't find where to give. And I'm like, see, these are things we need to find the slickest route to. The second you had that thought to give, we want there to be something that can catch that. And so the timing piece has been important to us because it really tells you who's going to be the most ready to hear from you and who's that experience freshest in the mind for. Now, of course, that also gives you the feedback of like, I had to wait in the ER, for 5 hours, and we get to hear that too. And we get to report that back to the hospital staff, and we get to improve our programs through these feedback loops from more relevant, timely stories. Because sometimes you'll hear, you mail them in a year and a half because, you just picked a random list, and it's a lot of static that you're getting like, oh, 3 years ago I had this bad experience. There's not much we can do about that. Um, and maybe they had a great experience. And at that time, had they been asked, they would have given 3 times as much, but it's not as relevant in their mind. And they feel a little less moved. And now they want to give, just a few bucks. So, I think this is just how it's relationship building. It's just letting them know we're here, we're doing the hard work behind the scenes, and we want to honor you by if you feel that you're a part of this vision with us, we want you to walk with us and we want to give you a ton of ways to get involved. And if we're not doing our job of finding who you are, we can't expect you to, go out way out of your way to find who we are because there's a lot of people who are dealing with some really hard things when they or their family member are in the hospital.
Yeah.
Yeah, the philosophy that you were just mentioning, I think really stood out to us too. This kind of concept that you had mentioned earlier about being more interested in what you can learn about the donors more than just how much you can raise from them. So I am curious to kind of actually wrap things up with us here for a fundraising professional who is just getting started with a tool like DSAI or some of the other tools used for annual appeals, or I guess how it ties in with major gift officers too. What does that mindset shift, look like in practice?
Yeah, I think I always think if you're setting out to use tools like this, the pressure to use them and perform and have an outcome and get money and justify the cost is going to kill any creativity, and you're not going to do what you're setting out to do. If you have the growth and learning mindset that the value is in me learning who is out there, just like if you're learning about a person, the value in that relationship is not in what can I get from them, it's
Hmm.
what can I learn about you that shows a common interest and common goals between us, and how can we build a relationship off of that, is to have that mentality. What can I can how it's going to be slow incremental learning and growth, especially with a new tool that needs to be embedded and the culture changes that need to happen with it. It's the patience of not quick wins. These are long-term investments, and that will pay off. Just like trust that the more interest and insight, the more interest in your donors you have and insight you're willing to pull from it over time, like let it be like more rich wisdom than quick win information, run a new appeal and test that and then change. It's just let it be let it be more research and data driven than performance in an immediate, this quarter I need to prove to my boss that this was a worthy investment. Don't let it be so ego, because the donors can sense that and it doesn't actually yield long term what you want it to.
Great advice. Uh, I gotta tell you, I'm really happy, when we had mentioned tripling the annual appeal that you mentioned the actual numbers itself too. Congrats going from a 1.1 to a 3.2, was it?
Yeah,
That's unbelievable.
I agree.
It blows the recent fundraising activities I've been doing with my daughter's PTA out of the water, let me tell you.
You've got a goal for next year.
Yeah.
It is really, though, I feel like to see these numbers grow, especially at the annual level. I come from an annual giving background, and so I'm just hearing you talk about all this stuff. I'm like, oh my gosh, when I was working in that realm, I would have loved to have been able to approach everything the way that you are, and I'm inspired, even though I'm no longer working in that specific industry to
Mm,
do it. But I just feel like this is something just to hear how thoughtful and intentional you are about your approach to this and looking at everything holistically and how do all the pieces fit together. I think that that's something that a lot of folks will get some good inspiration from. So thank you for sharing with us.
thank you so much. And yeah, thank you for supporting the tools that you're supporting, and all the pieces you have for hand holding in your like DSA. The team is amazing, and did a lot of really in-depth, we're here for you, we're going to work through these things, we're going to design it together, and I've so appreciated that, so thank you.
Absolutely. I also got to say, I don't know if it's just the calming background or something, but I feel soothed. I
I
feel in
do.
a good state of zen.
Yes.
Oh, or could just get it back to now it's 3 p.m. and it's time for the afternoon cup of
Yeah, it's
coffee.
nap time.
Maybe a little bit of that too. But no, it was an absolute pleasure to talk to you. Thank you so much.